Hi, how are you? This is Dr. Damaris G, and this is the Mindfully Integrative podcast. And today we are having a wonderful guest and mindful chat with Charlene Platon. She is Director of Stanford Health in Ambulatory Services, as well as the Johnson & Johnson Innovation Fellow. And she's also started a CEO of a company called Fifth Window. It was well in wellness, and she'll tell you a little bit more about that and how she implements mindful ways in her practice, in her life, and in her work. So, thanks so much, Charlene, for joining in on this podcast.
Thank you so much for having me, Damaris. I'm so excited to be here.
Yay! I'm glad. I see your picture is what San Francisco. Are you calling from and on the YouTube channel for on like from San Francisco?
Yeah, I'm based in the Bay Area. I'm in Redwood City, so I guess that's technically Silicon Valley.
Right. Okay. Because of Stanford Health, that makes sense. I was out
Right.
there a few years ago and I loved the redwoods. I know with the fires and stuff, it was a lot. Um,
Yeah.
so tell us, like first off, what's a little fun fact about you that people may not know if they looked you up?
Yeah. One fun fact about me, well, people may or may not know this, but I'm actually a twin. And
You're a
I
twin?
have,
Oh,
yeah,
cool. I didn't know.
yeah, I'm an identical twin. And it's funny because my twin sister is also a nurse and she was practicing as a psychiatric nurse for many years at UCLA. And it's just funny because when I was practicing at the bedside, I had always done more towards medicine. So we always joked about that.
And she's more bedside and you're more on the that's cool. Yeah, I know. It's like, it's like siblings, but that's cool that you guys both were in the medical field and you guys she's still practicing?
She actually transitioned out of the bedside not too long ago to go full time into her own business. So now she's full time working as a weight loss coach, and
Oh, wow. That's great.
yeah,
That's
her
pretty cool.
business is called Sugar Free Self Care. So it's
Oh, nice.
not too
Well,
far from
yeah, maybe
what I'm
we'll
trying.
have her on the show too at some point.
Yes, she'd be great. Yeah, she's an inspiration for sure.
Oh, very cool. Very cool. So, tell us a little bit about yourself, kind of where, your story starts. Some people talk about their childhood, all the way through up. Where kind of brought you into this kind of thinking? Because the integrative health space and the wellness space is, kind of a certain realm of us that want to, make change. We're still, trying to teeter between traditional and a different path.
Yeah, thank you so much for asking, Damaris. And, in terms of my nursing journey, I come from a family of nurses. So my mother's also, she's an ICU nurse, and there's many relatives in my family who are in nursing, and that's how I was introduced to the profession. But I had started in bedside. I was working as an acute care nurse in the telemetry unit, and I just realized that throughout my nursing career, I had actually been involved in innovation in some way, but I never called it innovation just until recently. I really
Yeah.
only thought of it as innovation actually after I watched Rebecca Love's talk about nursing innovation. And after seeing her on the TED stage, I was thinking to myself, wow, this is actually innovation that I've been doing all this time. But throughout my nursing career, I had done different types of innovation, whether bigger or smaller. But I think it all really stemmed from seeing different patterns within the healthcare system and wanting to do, the best that I could to improve the experience for both patients and for staff. And I really wanted to focus on how we could impact patients or the healthcare system on a broader level because I
Yeah.
did see that as a gap at the bedside, but I also saw that as a big opportunity for nurses in particular to fill because there's just so much expertise that they have, and they really know they know the problems in and out, and they really know how to fix them. And I think that's what led me to the successes that I've seen in my innovation journey. But I would say that that's really where that stemmed from, just in a nutshell.
In a nutshell, I mean, just in a nutshell, kind of
Yeah.
transferring. And then, so, have you like, so what exactly is your innovation that because you were in with, I met you, Charlene, well, through Sancial, which is, a wonderful leadership group, and also through you are also a Johnson and Johnson fellow, innovation fellow. And I'd love for you to explain that to our audience.
Yeah, thank you for bringing those up. And those are great,
I know
great
they're
initiatives.
passions and
Yeah,
amazing work that you guys are doing. So please talk about it a little.
yeah, of course. And I first heard about Sanciel through the Johnson and Johnson Nurse Innovation Fellowship, and what that program is. It's a 2-year program that's focused on equipping nurses with entrepreneurial innovation and leadership skills. And so it's a really unique program because it's one of the first of its kind, I think, in the nation that has been brought to the forefront. And the aim for the program is really to promote nurse-led innovation across the global stage. And so there's 12 of us in the fellowship, and we are all part of this first cohort. And it's just been so amazing because I really feel like I found my tribe in nursing. Everyone who's in the J&J Nurse Innovation Fellow, a lot of them are in Sanciel as well. So, that stands for the Society of Nurse Leaders, entrepreneurs, and scientists. And so there is just so much passion and energy just connecting with a lot of these nurse innovators. And so Sanciel really it's really like this collective of inspiring nurse leaders and nurses who work in all various aspects of the profession. And that, we all come together in various different ways to share ideas, to start initiatives, and they just have so many different opportunities. So it's a really great organization as well.
Yeah, I completely agree with you. I love both organizations, and I'm not a fellow, but I definitely am part of Santiel, and I met so many wonderful leaders and so many wonderful people through the group, and I'm so grateful to each one of you. In some aspect, I feel like we've all kind of are making impact and trying each and every day to do something more in the nursing field, and then like you're saying on a global stage, it's quite phenomenal. So going on the point of, you're innovating, you're not only an innovator, but you're a director of ambulatory services at Stanford Health, which is not a small task in itself. How are you getting through that? Like that, so do you have any struggles through that? Have you kind of, what made you kind of, go through that path?
Yeah, leadership is something that I've always been passionate about. And I don't know, sometimes it's just funny how these different opportunities just come to you. And
Yeah.
I just, you can't explain it. It just somehow falls in your lap throughout your life and you're like, "Oh, maybe I should do this." But
Yeah.
throughout my life, even, from when I was younger, I just always found myself in leadership opportunities, and it just felt, natural for me to assume these types of positions, but more so because I was passionate about helping with a challenge or helping with a problem and wanting to fix that. So it really ties in closely with my passion for innovation as well. And I transitioned into this role as director of ambulatory nursing at the beginning of the pandemic last year, actually.
Oh, wow. So it's
So it
wow,
was a
fairly, and what a
challenge.
time to transition. The pandemic, that's when you got it. Wow, that's got to be a lot.
It was so funny because I distinctly remember in early 2020, I was like, "Oh my God, this is going to be the best year ever," because I had just been promoted to this new position, and I had been actually accepted as an instructor for this fitness studio that I love. And and then I was still riding the wave and still reeling in the whole being accepted into the Johnson and Johnson Nurse Innovation Fellowship. So there was a lot of big things happening in in early 2020, and I accepted that job offer for the ambulatory position in March. So right before all this happened. So I didn't know what was to come, but it was definitely a challenge. Before being in the director of ambulatory nursing, I was working as manager of advanced practice, supervising nurse practitioners and physician assistants on the inpatient side.
Right.
And then just so I'm really grateful actually that I got to see the difference
I'm a nurse
navigating
practitioner
through.
now, so I totally, you would have
Right.
probably been managing me.
Oh my gosh. Yeah, there were so many wonderful APPs or advanced practice providers, and I really miss working with them. And it was really great to actually see the difference between the inpatient side and then now transitioning to the outpatient side, especially while navigating COVID. And in the inpatient side, I mean, there was so many challenges just first trying to navigate what is this, virus? What is this, like, what do we have to do for our policies and procedures? So that was really challenging.
Hmm.
And then transitioning to ambulatory, it's a lot of different challenges, just a lot of them are still policy and procedure related, but now you have to focus on other things like vaccinations and clinics. Do you close the clinics, open the clinics? So there's a lot of operational challenges too in the outpatient side. So I feel like I got to see a really great scope and lens for healthcare operations during this transition during the pandemic. Um, but yeah, it's definitely, it's been challenging, but I actually really love being in this role with ambulatory nursing and helping to support ambulatory nurses, because this is still fairly new terrain for nurses to be in the outpatient setting, and for people to know about nurses in the outpatient setting. So I'm glad to be a part of it.
No, I think it's so important, especially because of this last year with the pandemic. And like, I mean, I'm an outpatient provider, and I know that it's like there's a big gap, and you're kind of filling. Have you noticed there's probably not even just on an integrative side, how there's probably a lot of other innovations to come. I do a lot of telehealth stuff too, and I feel like there's a lot of innovation things that are needed to get this, these nurses cared for. Um, so let's talk a little bit about your innovative. You had it was like wellness nurses, fifth window. Please, like, talk a little bit about that because it seems really cool.
Yeah, thank you for bringing that up. And I'm so happy to chat about it because, all of this first stemmed from the COVID-19 virtual hackathon from the Nurse Hack for Health that took place in May 2020. So last year, Johnson and
The
Johnson
mix of it,
collaborated.
right? Yeah.
Right in the middle when everyone, I mean, it's still really challenging, but that first wave and all the unknowns, it was particularly challenging. And so Johnson and Johnson collaborated with Microsoft and Sanciel and DevUp Conference to launch this virtual hackathon. And I immediately saw that there was a resiliency and self-care track for this challenge. And I was so drawn to it because, I mean, throughout my nursing career, I've been burnt out several times. I feel like any nurse or most nurses would tell you the same. It's a challenging profession, and there's a lot of opportunities for that are rewarding, but there's also a lot of areas that might cause some burnout. So I found out about the hackathon and I really wanted to join because I knew that was going to be a challenge for nurses. It was already a big challenge back in May of last year. It's still a big challenge, and we are still not, recovered from all this. And burnout has been documented in nursing or in healthcare since the 1970s, probably earlier.
Right.
And yet it's only really been with this global pandemic, which is a huge, global healthcare crisis, that finally we're starting to move the needle somewhat. But I don't want us to lose momentum on it. So I really wanted to be part of the solution for how we could change the narrative when it comes to healthcare and mental health and really self-care, because there's just so much stigma. So when my team and I participated in the hackathon last year, we were really fortunate to win that track for self-care and resiliency. And so ever
I
since
love
we've
it.
been working on it. Yeah.
Yeah, definitely part
And
of my passion. So I love it.
and we were called Well Nurse app before. And so now we are in the process of transitioning to a new name, which is Fifth Window. And I'm happy to share more about that too.
I know. I mean, it's a totally different word. So, what kind of brought that? Like, that's not just something you just kind of come to. So you guys must have come, or was this more on you? Because you're the CEO of the company now, correct?
Right. And actually the company has we have four co-founders, including myself, and three of us are nurses, and the three of us met during the hackathon. So it's really great
Wonderful.
to still have some of the original team members who were in our group from that hackathon. And it just really is a testament to how much passion we have, because 1 year
Yeah.
later we now actually have a tangible app, which is really, really cool.
That's
Um,
really neat. Can listeners like download it? Is it available?
Yeah, actually, it's really exciting because, and I'll talk about the name too. And,
Yeah.
but it's really exciting because we are launching our open beta test for our app on Nurses Week. So on the first day of National Nurses Week on May 6th, we're going to open up our app for download for both Android and iPhone users. And so, we had been doing some rounds of testing, and this will be the first time that we'll be able to open the doors to a much broader group of nurses who want to try and test the app. But if anyone is interested in that, you could just visit our website at www.fifthwindow.com. And that's spelled out FIFTH window.com. And we'll have all the information there for how to sign up for our beta test. But we could have up to 10,000 nurses join. So we're really looking for as much feedback and as many people to try it out and let us know how, we can make the best app as possible for our nurses.
Oh, that's so cool. I can't wait to share this, with the listeners, and, put sound bites and put it out to, get it out there for everyone. So, how exactly did you come up with Fifth Window?
Yeah, and we wanted to we had to change. Well, first I'll just share that when it comes to entrepreneurship, there's a lot of different challenges that come up, and, and
Oh, I
I'm
I
sure,
do know that.
as you know, and we could talk for like there's not enough time right now to talk
No.
about that. We
No,
could talk
none of
about
that.
that during
Between
it.
leadership and entrepreneur, there's always something that I'm changing or innovating and changing up.
Yeah, there's no shortage of different things that will come up, but one of the challenges that we faced in our team was actually our name. And for those who are trying to start their own business or company, or startup, I feel like choosing the correct name is perhaps one of the most important and one of the most challenging decisions that could come up for the lifespan of the company. And so when we had titled ourselves or called ourselves Wellnurse before, we didn't realize until later down the road that there was actually another company called The Wellnurse, which is great. However, they're in the process of trademarking the name, and so we had to change our name, and I could understand that because we don't want to confuse. We don't want to confuse different people who might be interested in the different types of companies. So it's something that a lot of entrepreneurs go through actually is choosing different name. And I've talked to a lot of my friends who are entrepreneurs and almost all of them have had to change their name at some point,
Oh,
which is
100%. I think I've gone through three names and different things. Yeah,
right.
100%.
Right. So Fifth Window is actually our third name because there was
Yeah,
there was another
100%.
name we thought of, and then we found out we did a trademark search and we found out there's another company that was similar to that one, and so we landed on Fifth Window, which is interesting because we actually are referring to the different dimensions of well-being. And so when we say fifth window, we're looking at, when we talk about the different dimensions of well-being, there is your physical well-being, there's your psychological well-being, but then in terms of healthcare, there's also your professional well-being and organizational well-being. And so the fifth window is really encompassing all of these different aspects of wellness altogether. So
Right.
it's really just the balance of all of these different types of wellness and well-being. And of course that might evolve over time, and we're still trying to see other avenues for in terms of how the meaning for that. But that's we really want to embody the different areas of wellness that nurses encounter throughout their career.
Through their current yeah, that sounds really cool. And so now your app is launched already, or you're in the beta test, right?
Yeah, we're in the beta test, and after, it'll be on May 6th, and we'll open up the app for free for nurses to try, just in exchange for some feedback. And we have some surveys that are associated with the beta test. So if you're really, willing to try it out, we would love to have your feedback. And of course, with the feedback, we've been able to improve our app at this point to what it is so far. But after that, we do plan to launch our app in the App Store for both Apple and for Google Play. We're aiming for the summer. So we're
That's
just trying to
exciting.
see. Yeah, it's really cool and it's
I
just
mean, with
awesome.
like purchases is it going to be a free app and then like in price, in purchase, or are you going to have it for like people are going to buy the app?
Yeah, so it'll be a freemium version. So we do want to, first and foremost, we want it to be available to as many nurses as possible. So we do want to have a free version so that there is like a level of content that's available to all nurses who are trying the app. And
Right.
then for the premium, that would include extra features that you would pay for. And that would include things that would help make the experience better in terms of, your wellness and well-being. There's different features that we're looking at too. So, and so that's how we're planning to price it at this point. Of course, with entrepreneurship, all these things can change. So we're continuously going to work on that.
That's really exciting. I mean, I can only, it's just, it's one step, right? And then it grows, and then you never know how much more it'll grow. That's
Hmm.
really cool. So when you like through your life and or through your work, was there anyone that inspired you kind of to get into this, into this work, not just nursing, but like obviously into this wellness thinking, the burnout, obviously we're saying you transitioned and thinking about burnout because of things that were going on, but was there anyone that inspired you or a quote that you kind of reach out for when you need a little extra?
Yeah, there are so many different influences that have led me to this point, and one of the things, or one of the people that has been really inspiring, or one of the foundations, is actually the Keeley Foundation, and it's actually focused on meditation. It's one of the practices in terms of meditation and helping with the idea of detachment. That's one of their main focuses, and that's a practice that I've been doing, for the past several months, including last year of the pandemic. I've been practicing Keeley meditation, and
Hmm.
so I do this meditation for 5 minutes in the morning, 5 minutes at night, and it's really been phenomenal. The difference, in addition to mindfulness and
Hmm.
other self care
Other
practices.
self, right?
Right, and there's so many different types of meditation, practices, and this
Of
is one of them.
course.
And, yes, and from the Keeley Foundation, the founder is Ron Rathbun, and he actually created a book. He wrote a book called The Way Is Within, and that's actually been a really great book just in terms of spiritual teaching and helping with promoting self-care, and just helping to promote this idea of really looking inside yourself and figuring out who you are, and how that helps promote your own well-being. So that's been something I've been reading and utilizing just recently. But in general, I've really, in terms of meditation tools, I've downloaded like all the different apps, and one of my goals is to use all the different things that I liked from all these apps and combine them into one, and use that for a fifth window. So
Yeah, I mean that's
Mhm.
then and as you're working working through this, it'll come up, and as you're sitting in your quiet times with your meditation, it's more is gonna unfold. I can only imagine what's gonna happen for you,
Mhm.
and for your business and just for you in life. It sounds like you're doing such wonderful work, and just keep up at it. I'm like so excited that you've been a guest on the show. I wanted to say, is there one thing that, one mindful way or one tip that you'd like to share with the audience today?
Yeah, I would just say, when it comes to your well-being, I would really just encourage you all to really just spend the time. Something that really helped me with this, because I wasn't always a practitioner of meditation, but something that really helped me was starting really small. Like seriously, I would only do meditation for like 1 minute, and then I would increase it to 5 minutes, and then I would increase it to 10 minutes, and that's been a really great sweet spot for me. And I think just in terms of any practice, starting small, and that really helps, and that goes for all types of self care. So I'm trying to go back now to my physical well being, because with the pandemic, it was hard to go to the gym, but now I'm starting to look into
Yeah.
that again, and starting really small, like small bites, and over time it really leads to some amazing progress. So I would really share that as my tip for today.
I love it. No, I mean it's because people need those I call them mini wins and the small wins, and you're you're giving them a little taste of that, and I appreciate bringing that and telling them a little bit about your story and your tips, and I cannot wait for them to learn more about you. I'm gonna have all your information in the show notes and links. But is there anything? I mean, you were talking about the Nurses Week. If you want to talk further about that before we go.
Yeah, sure. Thank you so much, Damaris. And as we were mentioning before, Fifth Window is launching our open beta test. It'll start on May 6th, which is the first day of National Nurses Week. And we invite all nurses to download our beta app and basically have you try out the different features for free. And we would love to hear your thoughts. And we'll have a lot more information about that as we approach Nurses Week. But if you're interested in joining our open beta test, please visit www.fifthwindow.com, and that's FIFTH window.com. And we will have a lot more information there, but we really look forward to, revolutionizing nursing well-being and really, really promoting this safe space for nurses.
I love it. You'll keep up all the great work, and I loved having you on the show. Thank you so much. And and then I just wanted to, tell our audience, they're going to reach out to you. Please do. And I hope ending on this show, Mindfully Integrative Podcast. Audience, thanks so much. And thanks, Charlene. I hope each and every day you guys find a mindful way. Namaste. Thank you, Charlene.
Thank you so much, Damaris. It was such a pleasure.
Anytime. I'd love to have you back on the show.
Oh, yes, anytime.